Hey there, Dr. Christianson here. So will it come back? I want to talk about 7 reasons why Graves won't get better without doing anything, why it won't go away on its own. The big thing is that this disease is rooted in gene susceptibility. So there's genes that encode your body's processes for managing iodine within the thyroid, for carrying out methylation reactions, and also managing the burden of environmental toxicants. And because of that, this susceptibility doesn't go away unless it's managed properly. And by doing steps like avoiding folic acid, we can manage it really well. Another big reason it tends not to be self-limiting without some targeted treatment is because of everyday iodine intake. If you're consuming more than about 300 micrograms of iodine per day, that can keep you driven into this perpetuated cycle of hyperthyroidism. Another big reason that it can persist or not go away would be just smoking status. So we know that cadmium and also other compounds in tobacco smoke are among the toxins that drive the immune response against the thyroid. So please don't start and please stop. It's a critical part about recovery for you. Another big one is just low selenium status. So selenium is this critical mineral that helps to regulate iodine. It helps to control free radical damage. It calms the immune system. It helps detox. It does a whole lot of things that are very central to Graves and thyroid function. Lots of people don't have enough selenium. Please get a couple hundred micrograms in your multivitamin, and please eat 1 Brazil nut per day. Those 2 steps alone can go a long ways towards assuring that your selenium status is in good shape. Another big factor is the total stress levels. So it's been shown that Graves is more apt to come on after some type of an acute stress or an acute trauma, major life transition, a change in relationship, a move or a separation or a loss. These are all big triggers that seem to cause Graves to come on. And we think that it ties into your cortisol levels. So, you can't control all those big things, but have some system of day-to-day stress management. Journaling, breathing therapies, meditation. On a regular basis, these practices raise your resilience. And when the things roll around in life, which they do every so often, they can make you be less affected by all of it. Another big one is PCB exposure. These are polychloral biphenyls, and these are compounds that are very persistent in the environment. So they stick around for years and years. We're exposed to these from some types of fish and seafood, especially farm-raised fish, and then also plastic byproducts. So please avoid plastics whenever you can. Probably the worst thing you could do would be to take saran wrap, cover it with food, and then heat that food. So also plastic food containers, plastic straws, minimizing plastic, minimizing farmed fish, you can keep your PCB exposure lower, which is great. Now here's the biggest reason why Graves may not be self-limiting unless the circumstances are right. The biggest circumstance is called the hyperthyroid loop. So having too much thyroid hormone, that can worsen the autoimmunity that causes you to have too much thyroid hormone. So that's the vicious cycle. So a critical part about our Graves recovery program is moving you out of hyperthyroidism. So calming and slowing the thyroid. And once you're moved down to your TSH is greater than 1, then that allows that loop to start to break. And that allows it to where you can start the clock ticking on your full reset and your full recovery. And that's the beautiful message, is that the recovery is possible, it's natural. Once we break these factors and set the conditions for you, you can be on your way to having your thyroid reset and function fine on its own again and being cured of Graves. Dr. Christianson here with you. Take great care. We'll talk again really soon. Bye-bye.